So, very good afternoon to one and all. Once again, happy to be with the Veda Education group to discuss on the session Tourette's syndrome and Ayurveda. Okay, so when it was told Tourette syndrome, actually for me it was a very fascinating journey to learn more about Tourette because for us in our clinical practice, too many Tourette syndrome have not approached. It's a very what do you call it as, maybe I feel things which are very mild are considered as habitual things. It need not be considered at all. Serious cases, a few of them I have observed, and in that background, I'll be communicating with you Tourette syndrome and its Ayurvedic perspective. So I have divided my presentation into two parts. First part, I think we will just have a simple understanding or overview about Tourette syndrome, its contemporary understanding. And the second part, how in Ayurveda we look at Tourette syndrome, and then how can we manage it, and what is the basic protocol that we follow for managing Tourette syndrome. Now, when we think of what is Tourette syndrome, as we understand, Tourette basically, if we understand what exactly is the cause of Tourette syndrome, it's not been understood to a greater extent still. It is a genetic neurological disorder which is actually characterized by chronic motor as well as vocal tics. As you all know, tic is, the word that is again something that is repeated again and again. So it can be either motor, which involves physical activities, or vocal, which involves our speech related things. And usually it begins before adulthood. So typical presentation of a Tourette syndrome is basically, stereotyped movements and vocalization. Like, yeah, like this sometime, or some people have this movements, kind of small things to different behavioral presentation. So blinking can happen just like that, blinking, sniffing, different facial movements can happen, some movements with legs or hands, upper limb this way. So these typical presentations are usually seen in Tourette syndrome. So, there are actually diverse abnormal movements and vocalization that can be classified into tic, that can be motor vocal, and it can be simple or complex. So the typical characteristic of tic is basically it is non-voluntary. That means, we are not doing it consciously, or that doesn't happen consciously. It usually happens before 18 years of age. It can move from simple to complex. So that is the typical specific understanding that happens in Tourette syndrome. So when we are thinking of simple motor tics, it indicates it involves only one single muscle or a single group of muscles. Like, as I told, eye twitching, nose twitching like this, or this sound making, okay, neck twitching or jerking or some eye rolling. So only simple or single group of muscles involved in simple motor tics. At the same time, in complex motor tics, it involves movements of multiple muscle group, like, hitting someone or jumping, shaking, etc. involuntarily. That includes complex motor tics. So, there are also another than motor tics, that is physical. There are phonic tics, like, it happens through sound as such, wherein simple sound, grunting, throat clearing, like that throat clearing, blowing also can happen. And there are also complex phonic tics, wherein, there are vocalization of words or complex phrases that, sometimes it may be exclusively socially inappropriate to understand, why this is happening. The patient may not be willfully even doing that. So when we are thinking motor tics, it can be simple motor tics, complex motor tics, similarly simple phonic tics and complex phonic tics. So generally, when we are thinking of Tourette syndrome, many a times it coexists with other underlying issues also. And when we think, is it an exclusive organic issue with the nervous system? No, it mainly has got a behavioral content to it many a times, along with the clinical physical features. So conditions like ADHD, attention deficit hyperactivity disorder, OCD, obsessive compulsive disorder, behavior problems like lack of sleep, poor communication, poor impulse control, all these things in the background of repetitive movements like tics continuously come together to known as Tourette syndrome. So, associated neurobehavioral manifestations, as I mentioned, it includes ADHD, OCD, poor impulse control. And when we see, historical background of Tourette in the contemporary medical science, I think it was first described in France in 19th century when a lady called Dampier was who was a very amicable, socially amicable, very friendly individual who suddenly has got some social verbal obscenities happening again and again, very involuntarily, and the physician over there had tried to understand it in the background. And I think it is Jean Marc Itard, the French physician, who had first described it. And Charcot, the who is known for his Charcot-Marie tooth disease professor, his resident Gilles Tourette had was given the opportunity to report on the patients with repetitive movements at Salpêtrière Hospital. And later he was the person to continuously document the content, and hence the disease was named after him, called Tourette syndrome. So it was he who was assigned to define an illness which is actually distinct from hysterical presentation, but these repetitive movements also. So, historically, the name was given after the documentation by Tourette under Professor Charcot. So, so that was the first description that was told in 1885. And if we see about the history from India, when we are describing these spectrum of diseases, you could see actually in Agnivesha Samhita, which is actually the pre-book to Charaka Samhita, there were observations, clinical observation regarding involuntary movements. In the sense, we are not doing it voluntarily, but it's again happening again and again. And this actually, the whole symptoms which are classified or characterized with repetitive movements are titled under the name Akshepakam. So it comes under the word Akshepaka Vyadhi, which actually includes all involuntary movement disorder spectrum of disease. Now, so whenever we are talking about the pathophysiology, what's happening in Tourette syndrome, I'm anyway not going into the detailed. There are actually so many theories that are put off, so many observations also. You may be knowing about basal ganglion, which are actually gray matter inside the white matter inside the mid portion of the brain, which has got many mechanism with respect to the behavioral control, everything. So the dopamine and serotonin uptake and secretion that happens within this basal ganglion. So there is a dysregulation or abnormality that is seen usually in those cases who are having Tourette syndrome. Actually, this observation was done after postmortem of the brain of the people who had these, and further when other mechanisms of investigations came up. So there was some problem or dysregulation in the uptake of serotonin, in the uptake of dopamine kind of things in the basal ganglion, and other things like globus pallidus, thalamus, etc. So generally in Tourette syndrome, other than any specific organic lesion somewhere, the mechanism within the basal ganglion is found to be having a problem. Yeah. So, clinical presentation, actually, if you could see what all the issues can come under Tourette syndrome: pain, tics, insomnia, anxiety, sensory needs of gratifying, sometimes fatigue, in the background of other clinical situations like ADHD, OCD. So, it's just when we call it as Tourette, it's just not tics or repetitive movements, but it has to be included under all these presentation. So, when we say, usually the Tourette syndrome, which can start in childhood, and it is seen more in boys than in girls, almost 3 times more in boys. And, multiplicity of tics with combination of motor and verbal tics are coming under the Tourette syndrome. So from that, when we move, we could see the common verbal and motor symptoms, palilalia, wherein repeating one's own words, coprolalia, compulsive utterances of obscenities. These are the technical terms that we usually follow. And when we say it to be diagnosed as Tourette, the diagnostic criteria would include the onset must be before age of 18. Multiple motor tics must happen, physical tics like this movements. One or two vocal tics must happen, and it must be progressive in nature. It has to, become worse as the person ages or with other background. And sometimes there are no symptoms, sometimes there are symptoms, like it wax and wane, increases and decreases, and the duration has to be longer than 1 year, and there should not be any other disease in the background that actually precipitate these. So only when these things comes under the understanding of the condition, we finally diagnose it as Tourette syndrome. So yeah, so persistent blepharospasm, vocal tics, repetitive words. These other significant thing is courses of illness is generally unpredictable. There will be some behavioral patterns, poor concentration, impulsiveness, poor control of temper, as other things that can be along with the Tourette clinical presentation. Now let us come to the Ayurveda pathology. How can we understand Tourette disease in Ayurvedic perspective, our second part, and how can we deal with it? Now, when we think of the any motor activity in an individual, the first dosha that comes to our mind is definitely Vata. So when describing Vata, in Charaka Samhita, it is told Veda, Toda, Arti, Akshepa. Akshepa is repetitive movements. So different kinds of pain, Veda, Toda, Arti are different kinds of pain, pricking pain, cutting pain, and different kind of repetitive movements. All this comes under the vitiated Anila or Vata, and the specificity depends upon Hetu Sthana Vishesha, which means the specificity of cause, the location where it is happening, and the specific trigger that is happening over there. So we have to be understanding Akshepaka coming under the broad spectrum of disorders caused by vitiation of Vada, which should be understood with special reference to specific cause, hetu, location where it's happening, and specific triggers. So, the importance of Vata in neurology. Vata is responsible for maintaining all motor activities. Vayuhu tantra yantra dharaha pravartakaha cheshtanam uchavachanam. It is, initiator of all physical activity. All activities are initiated by Vayu. Also, Indriya Udyojakaha. That means it coordinates and stimulates all Indriyas also. All Indriyas in the sense all our sense organs to hear, see something, and something is triggered. So all initiation of movements happen through Vayu. And when we see generally with respect to the function of Vayu, it depends upon, how active we are, Utsaha, the breathing pattern, and all our physical motor activities is controlled by Vayu. So definitely when we are planning of Vata disease in the background, when we are thinking of Tourette disease, Vayu is the most important causative factor in the background. So when we again think of what are all the types of Vayu that is specifically vitiated, we could see that you all are aware of the Panchavayus or the 5 types of Vayu: Prana, Udana, Samana, Vyana, and Apana. Among that, Pranavayu, the first thing which is responsible for intelligence, is primarily first thing that we need to think of as a part of physician, because Pranavayu's location itself is, the upper part above the shoulder area. Also, the Udana Vayu, which is specific with its activity related to speech. So, all Vak Pravarti, speech, energy to work, strength, memory, and the urge to do something, your intelligence, dhriti, that means your retention capacity, all depends upon the Udana Vayu. And we could see that the Udana Vayu is also affected in Tourette. And along with Prana Udana, we could also see that Vyana Vayu, which is actually responsible for the controlled movements, walking, etc., of an individual. All our upward movement, downward movements, closing, opening of eyes, it is all controlled by Vyana. And rapidity of the body is regulatedly controlled by Vyana. So we could see that in an Ayurvedic understanding, in Tourette syndrome, the Pranavayu, Udanavayu, and Vyanavayu are seen to be majorly involved. Yeah. Then as we move on, so these are the 5 Vayus. We could see the location: Udana, Prana, Vyana in the whole body, the Samana, Apana. So these are the 3 Vayus that we could see that is affected primarily. And then as we move on, next, from the Vayu, we could also see that Pitta's involvement is also there. The important Sadhaka Pitta among the 5 Pittas, Sadhaka Pitta, which is actually responsible for the development of unbiased intelligence, which already is depending upon, which actually has got its role in maintaining our psychological quality, our responses and behavioral patterns. So these are also related with Sadhaka Pitta. So a quality of Sadhaka Pitta is also relevant when we are thinking about the Tourette syndrome. And when we think of among the Kapha, the Avalambaka Kapha, which actually is responsible for nourishing all other Kaphas in the body, and which is also responsible for stabilizing the first dhatu, that is rasa dhatu, and whose location is again in the trika, somewhere near the hridaya sthana, that is heart area. So when we think of the pathological variables in Tourette, we could say that along with pranavayu, udanavayu, vyanavayu, sadhaka pitta and avalambaka kapha are also majorly affected. So, I think when we are thinking of the whole pathophysiology of Tourette in general, we must be thinking of about this prana, udana, sadhaka, pitta, vyana axis. Now, this axis I think is relevant in all most neurological dysfunctions, most neurological clinical entities. But among that, if we understand this, that this one is responsible, because pranavayu is in murda, hridaya, which is actually the place for sadhaka pitta and vyanavayu, okay, and udanavayu is also near hridaya, and from hridaya it is actually the vyanavayu which takes rasa all over the body. So it is actually the combination of prana, vyana, and udana that is responsible for maintaining the normal neurological functions, along with the presence of the most important entity, manas. So I think that these things, whenever we are thinking of motor activities and some abnormalities with our speech, prana, udana, sadhaka, vyana axis, we definitely need to think of. In the context, there is an entity called Sarvanga Vadam told in our text, Samhita, Charaka Samhita, which says Sarvanga Vadam has got symptoms like stambana, that is stiffness, akshepana, repetitive movements, sensory disturbances, along with on and off swelling with pain. So, whenever we analyze the clinical condition, Tourette can be included also under the spectrum of Sarvanga Vata. In this background, the role of manas or mind is also very important, because manas is something that is responsible for the connection from the senses to the awareness or atma or the consciousness. Manas is the entity that is attributed with karma or action, which is ultimately responsible for all motor and sensory activities to happen. Two more entities that we need to think over here is the role of upadhatu, which is actually considered as a secondary outcome from the main seven dhatus. So wherever when we go through the different clinical entities with akshepana, we could see, akshepaka, Kampa, Vepadu. Kampa is again tremor. Vepadu is high degree tremor. So these repetitive movements have Sira, Snayu, etc. as told in the pathology. So Manas has to be considered, and the Upadhatu, Sira and Snayu is also considered while treating a Tourette syndrome. So only when the complex of manas and indriya. Indriya means our sensory organs, whether it is our sensory organ of touch, speech, etc., smell, etc. This combination of complex indriya and manas with the initiation of vata, our activities happen, and when there is an abnormality, it is called Akshepaka. So, Akshepaka Vyadi, the definition in Charaka Samhita says, Yathatu Damanihi Sarva Kruddho Abhyetihi. That means when the Dhamani, the vessel to a particular area is afflicted by Vayu, that Angam, that local area, because of this vitiation through that vessel, through that channel of the Vayu, it results in repetitive movements. So here also we could see that along with Manas Indriya, the mentioning of localized affliction of Vayu is told while understanding the pathogenesis of Akshepaka or repetitive movements. Okay. So now coming to the third part, what is actually the role of Ayurveda in Tourette? So one thing, definitely in the perspective of preventive aspect, there are some family wherein we could see Tourette is having a familial background also seen. So, in the next generation, we can think of preventing it. Second one is reducing its severity, basically, if we continuously try to understand that. And third one is the progression can be arrested. So, in that context, we will discuss a few things what can be done in these perspectives. So, these are the three. I don't think like we'll be able to completely cure the clinical condition, but to an extent, the severity can be definitely be reduced or further progression can be arrested. So, I will talk in brief about the possible treatments that we can give in this condition. One is the role of Abhyanga or oil massage. Both the body as well as head massage with oil can be a good option. Regular application as a part of daily regimen, dinacharya, and which oil can be selected according to the prakriti of the individual, which has to be tailor made, and the different symptomatic presentations. Oils like Sahajaradi Thailam, Mahanarayana Thailam, Shirabala Thailam. These are the common things that we are using for body. And for head, we are using oils like Bala Guluchyadi Thailam. I feel, these are tailor-made oils that are available in Kerala generally. I think according to regional wise also, you can modulate different oils. If you are used to olive oil or, mustard oil or sesame oil in your place, the understanding of gunas of those oils need to be worked out, and it can be applied clinically, I believe. So You need not stick on to these things, but these definitely have clinical results in when we do that. Yeah. And then, when we from Abhyangam, when we think of role of Shodhana is, purificatory therapy. I think it has to be used very judiciously only. If only there is Pitta Kafanubandhatvam, there will be role of Shodhana like Virechana most probably in this case. That too also Mridu. Since, the disease is generally Vata Vyadhi, big role for Shodhana like Vavanoor Virechana is not there. Among that, Virechana or purificatory therapy is done commonly. Major among the purificatory therapy, the greatest role is more with Vasti and Nasyam in these conditions. Among the Shodhana or purificatory therapy, since the Tourette comes under Vata Vyadhi, major therapy is not indicated. Shodhana therapy or purificatory therapy like Vamana or Virechana is not indicated here. Only indicated one is mild variety of Virechana we do usually. So, yeah, and among the Shodhana, the most important thing among the 5 karmas, Panchakarma, Vasti and Nasyam has got a greater role than Vamana or Virechana. And the next important procedure that is most practiced in this condition is Murdha Taila or application of different varieties of oil in the head. Because head is the important place of pranavayu, etc. The thing is, we have to decide which one to do, with what to do, and how long to do. These are the variables when we think of application of Murdha Taila or application of oil in the head. And then other than Murdha Taila, next procedure is that is effective here is Shirolepam, that is application of special medicated paste over the head because it has got special affinity towards manas or mind. So, to control kapha and pitta at the manas level, Shirolepam or application of medicated paste over the head is used. So, along with these treatment, what we can do is following of dinacharya or daily regimen, ritucharya, rasayana can also be done. Yeah. So, in dinacharya, daily routine, regular exercises, application of oil over the head, and using of small oil over the nose regularly as pratimarshanasya can be practiced as a daily regimen in dinacharya. Yeah. And Ritucharya, that is seasonal regimen, which we usually do with respect to changes in the season. When it is cold and when it is hot, there are some regimens that are supposed to be followed. So that can also be practiced to evade or control neurological diseases. Now, see, as we mentioned, the Panchakarma actually acts as the stimulating purificatory mechanism. Other than the Panchakarma, procedures like Takradhara, that is this thing with oil, buttermilk, the pouring of buttermilk over the head, Shiro Tailadhara, pouring of oil over the head dhara, Shiro Piju, wherein medicated oil is kept over the head, Shiro Vasti, wherein the medicated oil is kept in a stored format over the head. These are the procedures that are suitable to the clinical condition. Yeah, Takradhara means pouring of buttermilk over the head. Okay, medicated buttermilk. There are some special medication which is processed with buttermilk that is poured over the head in Takradhara. Yeah, you could see that I'm actually showing the picture of doing a Takradhara, wherein medicated buttermilk which is processed is poured over the head. So this is procedure of Takradhara. In the same way, when we pour oil over the head, oil in that particular this thing, instead of this, we call it as Shiro Tailadhara. Yeah. So because this is the traditional dhara yantra which is used, wherein medicine is poured over here, and there is a string that is coming out of it, and this is modified dhara yantra that we are using actually. wherein a steel is put over the top part of the theater room, and that is used. So these are the different materials. So this is the traditional yantra you could see, and there is a wick that is kept inside, and the medicine is poured. And this is modified one. We have a steel mechanized thing put over the ceiling, and it is used. Both these things are used. Now whether to use buttermilk or oil or milk. Kshiram is milk. There is a type of mistake. Oil is here tailam. Okay. So it depends upon the guna that is vitiated. For example, if the individual has got kapha and vata more, we use takra or buttermilk. If the patient has got pitta and vata more, we use kshira or milk because of its guna. If the patient is having vata and kapha more in the symptom, Tailam, which is Ushna, oil is more hot in nature, milk is cold in nature. So Vata, Kapha, both of them are Shita, so Taila is used. So whether to use Takra or buttermilk or milk in the head or oil in the head depends upon the vitiated dosha in the individual, which we assess personally. So actually, these are the pictures of Shirovasti. Okay, wherein Shirovasti, the medicine is poured and made to store in the head. Other than that, Shirovasti, Shirodhara, the next important procedure that we practice over here is Shirolepa. Okay, so these are the pictures of making Shirolepa. Some special medications like gooseberry, amalaki, musta, which I'll type in the chat box, that is made and it is added with buttermilk. The final product is this way, and then we make a paste of it and we apply it. And this is a coconut leaf that is used. The oil is used to just do a head massage, and then this lapam is applied over this medicated thing is applied over the head. And the drugs that we commonly use is bala, mula, yashti, trufala, panchagandha, dashamula, etc., and according to condition. And this is put over the head in a specific pattern, and at the end we tie the head with the banana leaf continuously, and it is made to get stored for almost 30 to 40 minutes every day. So that actually has got a great role in controlling the emotions, the kapha and pitta at the manas level. So it is called as Shiro Lepa. In Malayalam, it is called as Talapodichil. Okay.
Okay, Dr. Rami, could you please do it in smaller parts with pictures so that people who are writing down, so they could follow better? Can we do it like that?
Yeah, sure. So these are actually picture of, yeah. This is the picture of Shiro Lepa. Yeah, how to make the medicine. Yeah. So, which, the medication herb is selected according to the case. So, the common herb is commonly we do is musta and amalaki, that is gooseberry, dried gooseberry, and musta, Cyperus rotundus, and also a drug called Panchagandham. Okay. So, these three drugs are taken in equal quantity and it is added with normal buttermilk, and we heat it and make it into a paste.
Could you please repeat the herbs? It was gooseberry, dried gooseberry, and then it was?
Then it was musta. The scientific name is Cyperus rotundus. And Panchagandham, which is a combination of 5 medicines. Panchagandham. So yeah, so that is there. Triphala, Yashti. Yashti is called as Glycyrrhiza glabra. In Pitta dominant conditions, we use Yashti, Glycyrrhiza glabra. In that. So, you could see, yeah, the final product. And here, usually the banana leaf is taken. Okay. So banana leaf is taken and the banana leaf is just made heated so that it doesn't break off. And then oil is taken to apply over the head. This paste is applied over the head and it is covered with banana leaf. So, you could see these are the medicines that we are using. Bala Moolam. Uh, Bala is the common, we call it as Kurundoti. Okay, so its scientific name I'm not getting now. Well, once I get, I'll tell you. Okay, Musta, Yashti Trifala Panchaganda that I had told. Sida cordifolia, Bala. Okay, which is Vatahara most. The root of Sida cordifolia is taken commonly. Okay, so you could see how it is applied over the head. First, the head, here it is tied. Then the paste is applied from here to here per head, and it is covered with the banana leaf, and it is kept for 30 to 45 minutes. Now, we also practice Rakta Mokshana, or actually bloodletting in different neurological condition. Since, as I told, Sira and Snayu. Sira is actually a output as a Upadhatu to Rakta. So, since Sira is Upadhatu to Rakta, in all Akshepaka Vyadis, Sira is mentioned. So, we practice Rakta Mokshana. It is now we are using hijama, the cupping method that you are seeing here in different clinical conditions. So that also has got a role in managing Tourette syndrome. Yeah, this is the cupping, which we are doing both wet as well as dry. Dry means no blood will come out. Wet means we are letting the blood out with the procedure. Yeah. So I think towards the end, there are also some of the internal medication that we use clinically. They include these yogas: Bala Kanakapatradi Kashayam, Dhanada Nayanadi Kashayam, Ashtavargam Kashayam, Bhadradarvadi, Brahmi Drakshadi, Kalyanakam. So, individual to individual with the symptomology, we use these many yogas also internally. And along with internal kashayas, liquids, we also use different medicated ghee, because ghee or medicated grita has got a special action at the level of manas, or the level of manas and indriya. So the commonly used ghee are Kalyanaka Gritam, Rasna Dashamulam Gritam, Brahmi Gritam, Mahakalyanaka Gritam, etc. And there is also role of rasayanam in these cases. Amalaki rasayanam, that has got special action at the level of our brain activity and stimulant. And the spectrum of Medhya rasayanam, that actually has got special action on cognitive action. Okay, so both these things has got an action, because in Amalaki rasayanam, the indication with respect to speech, words, all these things are told. In Medhya Rasayanam, again with special reference to the cognitive function, it is told. So in practice, we are using this Rasayanam Amalaki as well as Medhya Rasayanam. So among that, the commonly used in this background of Yashti and Ashwagandha. Maybe you are knowing that. So Ashwagandha is powder is added and boiled with milk and given. Yashti is also same, the Glycerrhiza glabra. It is boiled in milk and given internally. So I think towards the end, the conclusion, I think it's almost 1.5 hours now. So the conclusion would be Tourette can be included under Akshepaka Vyadhi. We have to find very specifically individualized pathogenesis with respect to the clinical presentation of every individual, whether it is simple tic, complex motor tic, simple phonic tic, complex phonic tic. All these things we need to find out, understanding the aggravating and relieving factors. So treatment possibility, as I followed, would be not to cure but to control, to reduce the severity. For that, we definitely on a daily basis must be following Dinacharya, Ritucharya and Sadvrittam. I think we will not discuss it too much because of time constraints. Sadvrittam is our code of conduct of how we must live in communion with the atmosphere and people around us to ensure a peaceful state of existence. Yeah, and Panchakarma, as I told, most importantly among the procedures, Abhyanga has got great role, Virechana and Vasti has got great role, Shirodhara and Shirolepa has got great role. Shirodhara with different materials, milk, takra, taila. Okay, yeah. So I think the last slide of my presentation would be, may the movements not make anyone move badly. Okay. May we have a control over movements, and may the mighty Vayu, because ultimately it is Vata that is in control of everything. So maybe may the mighty Vayu give us enough strength and control in all our movements so that we can even help people with Tourette. So thank you. We'll go for the questions.
The first question was about Parkinson disease and the scheme
Combination.
regimen. Yeah, I send you that.
Yeah. So basically, whether the question is, a combination of Mukta Pishti, I think, no, a combination of all together, Makaradwaja, Ekangavira, Makshikarasa, Pravala Pishti, administration of these things and giving 3 times. If you ask me, can this pattern be followed for a Parkinson's disease? My answer would be, see, Parkinson's definitely again have to be seen with respect to the clinical presentation. We have, there is, if we say this medication is for Parkinson's, I won't think it would be ideal to say that, correct to say that. The combination of medicines that is told over here are told for a different neurological presentation. So some Parkinson's may be tremor dominant, some Parkinson's may be what you call it as thamba or bradykinesia dominant. In some Parkinson's, other than motor symptoms, other symptoms like sleeplessness, non-motor symptoms will be more. So the Parkinson's can be Parkinson's or Parkinson's plus cases. So we have to identify the background, and accordingly only we will be able to prescribe medications for them. But definitely the combination that you have told above has got an indication towards that spectrum. But if I say this is indicated or this is right, I don't think I'll be justifying it fully. So Parkinson's have to be assessed and prescribed medications for that. Formulations are and bhasmas can be used in strokes and inflamed trigeminal nerve, right? Is that the question?
Yes.
Again, in stroke, there are different formulations that we use. Bhadradarvadi Kashayam, Ashtavargam Kashayam, Brahmi Drakshadi Kashayam. These are the things we use in stroke. And then again, bhasmas, Suvarna Muktadi, Gorochanadi Gutika, Pravala Bhasmam when there is more pitta, Godanti Bhasmam when there is more pitta, Siddhamagaradvajam, that is also used. In inflamed trigeminal nerve, whenever they will be having severe headache, we always make sure that the koshtam or there is proper bowel movements. In inflamed trigeminal nerve, prana and apana are always related. So we treat it with kashayam like Chirivilvadi Kashayam, along with medicines like Manjishtadi Kashayam or Mahamanjishtadi Kashayam, which has got a special affinity towards rasa and rakta dhatu, along with internal, bhasmas like rasa sindura, pravala bhasma, etc. So that is the way we approach these cases. So then the next question I think is, what formulations other than Ashtajurna can be recommended in IBS?
Yeah. It's not just, you can write under question, there is a respond button and it will be there.
Okay. Oh, there I have to write. I thought it down. Yeah, fine.
I'll read those, but next question, just you can.
Yeah, sure.
Okay.
So the next question is, what formulation other than Ashtajurna can be recommended in IBS and bloating? So in bloating, Vaishwanara Churnam, Dhanvantaram Kutika, then Hingvajati Kutika, Hingvajati Churnam. IBS, the thing, Kala Shakadi Kashayam, Vilvadi Kutika.
Okay, let's do the question that's in English. What is the course of procedures for Shirabhyanga and how often?
Shiro Abhyanga can be done as a normal daily routine. Okay. So people who are more Vata dominant can have 5 to 10 ml of the oil that just heat it and apply it over the head. Massage it for almost 5 to 10 minutes just before head bath. We always advise head bath after the oil. Okay. So, but if people are with kapha, like they are prone to cold, cough, etc., then we advise 2 to 3 days a week just before head bath and use head bath.
Now, what do you say? Head what?
Head bath. Bath over the head.
Okay, yeah, yeah. Okay, I
Yeah,
got
yeah.
it. Could you please repeat the Rasayana procedures, how they are done?
For what?
Rasayana procedures.
Rasayana is basically special medications that is usually given after Shodhana. So mainly with the two medicines that we are using in Tourette like abnormal movements is Ashwagandha and Yashti, which is prepared as milk decoctions. So Ashwagandha churnam, powder of Ashwagandha is taken, 10 grams of powder of Ashwagandha, 250 ml of milk added with 500 ml of water, reduce it to 250 ml, 125 ml in the morning and 125 in the evening. That is the way we have it.
Just to check myself, there was 10 grams of ashwagandha powder, that was 250 ml of milk, and 100 ml of water. Was it right?
No, 250 ml of milk and double water, 500 ml of water.
500, yeah.
Next questions, yeah.
Yes, in English again. Thank you very much for the lecture. You teach very well. The question is, which herbs should be dissolved in buttermilk and milk for Kriya Karma?
Yeah. So I think that is, we had discussed it, no? In buttermilk, it is amalaki. For buttermilk, it is again gooseberry. Okay. And then musta. In milk, okay. So in milk, we use nalpamaram, manjishtadi, and then dashamula.
So that was again about the indications for Virechana and Vamana. So are Virechana and Vamana indicated in some cases, maybe, or not indicated at all times?
In Vata Vyadhi, only when Kapha and Pittanubandhatvam is there. So, when these Tourette people have got where they are having very aggressive behavior, they are very violent with, very serious kind of injury or, obscene words coming up and all. In those conditions, definitely that is Virechana is indicated. Vamana is not very commonly indicated because kapha dominant situations are not seen as such. So Vamana is basically contraindicated in these conditions. So when aggressive behavior with irritability, etc., behavioral issues are more, Virechana is indicated. Yeah.
Okay, so Vegeta vascular dystonia. Which doshas are vitiated in this case? What are the recommendations? What medicines and drugs?
In dystonia is also coming under the big spectrum of akshepaka vyadhi. So there, common thing that we use is one is dhanadanayanadi kashayam. Okay. So dhanadanayanadi kashayam with balarishtam. And there is one special medicine now which we are preparing. It is called the Laghu Rasona Pindam. It is a powder from a text called Chakradhattam. That also we are using in dystonia.
Could you please write those down?
I'll just write the Dhanadanayanadi Kashayam along with the Balarishtam. Then one is Laghu Rasona Pindam. It is actually a formulation from Chakradatta. This Laghu Rasona Pindam. That powder, it has got this garlic powder, onion powder, etc. combination. Yeah, it's a book. The book name is Chakradatta.
So hyperactivity in teenage. Is it associated with disbalanced attention? What medicines can be used to bring it back to balance?
Actually, hyperactivity, again, we have to be assessing. Hyperactivity, if it is, during teenage, generally during that age period, there is always some excessive responses thing and all from people, also kids. So we have to assess, is there any anxiety, or some suppressed emotions? All these things will be expressed as hyperactivity, but otherwise we have to rule out autistic spectrum or ADHD. And if that is the case, we can definitely we have to rule out these things. Okay, what exactly is the cause? And if there is some suppressed emotions, etc., in the background, I think that has to be taken care of. The individual must be more inclusive. He must be, or she must be included. He should be addressed. I think psychological addressing is more important than medication. In medication, we use Manasamitra Vadakam, Kalyanakam Kashayam, Manomitram, etc. I'll just type those names. But this, what do you call it, is inclusive, emotional, psychological dealing is more important.
And when we talk about hyperactivity in children and teenagers, what are doshas and subdoshas in vitiation in most of the time?
You mean to say dosha?
Yes.
Okay. So in children, kids, they are generally kapha dominant. And when it comes to teenagers, from kapha, they move on to pitta. That is why in teenagers, this hyperactivity can be normal as a part of their growing physiology. Okay. So definitely, vata, whenever there is hyperactivity, vata is vitiated, but we have to think it at the level of kapha and pitta. So whenever vata's dominancy, we could see that manas is affected, whether it is in kids or teenagers, because generally in kids, kapha dominant, if manas is normal, they must have kapha diseases like respiratory issues, fever, cold, sneezing, etc. But then if they are hyperactive, it indicates their manas, because vayu is always connected with manas. So we must understand manas as the background understanding of hyperactivity in kids as well as teenagers. Anubandha or associated with vata mano complex would be kapha in kids and pitta in the other one. So manas only has to be considered as the important factor along with the vata, and their differentiation into samana udana, it's not possible at that age as such. It cannot be differentiated. The problem is at the level of manas only.
Okay. Then the next question: if we have Alzheimer's in an elderly patient, what aristas can be recommended?
I did not understand the question. If
Alzheimer's disease in an elderly patient.
Alzheimer's, okay, yeah.
What aristas?
Alzheimer's, Alzheimer's disease in what?
An elderly patient.
Elderly patient, okay. In Alzheimer's, again, you have to assess if Anubandha. With special reference to Alzheimer's, we give Saraswata Arishtam and Ashwagandha Arishtam as the common thing that we generally include. Saraswata Arishtam, Ashwagandha Arishtam. Yeah.
Saraswata Arishta, you said?
Yeah, Saraswata Arishtam, I'll just type. Which has got a special activity at the level of brain. Also, Aravindasava.
Okay, and we have one last question. Again, about dystonia. What doshas and subdoshas are vitiated in dystonia?
Understanding dystonia, it is again, Akshepaga Vyadhi coming under how, we have different kinds of dystonia, epistotonus, then balismus, hemibalismus, those kind of whole spectrum of abnormal movements are coming, choreatic movements. So the reason for dystonia, we have to find out. And then if we again see, dystonia has coming under akshepaka with symptomology similar to condition like antarayama, bahirayama, two different antarayama, two different akshepaka vyadis are told. There also we could see that the involvement of sira and snayu, which is upadhatu to raktadhatu, is more. And usually there in severe dystonia, we find a chronic involvement of apanavayu that is commonly seen. People who present with motor neurological movement issue, always they have their apana disturbed. That apana having its own action on prana and vyana can be considered, but primarily apana vayu is being to be vitiated in dystonic cases. Generally, what adult dystonia only I have seen. So since I'm a general practitioner, I deal with adult cases. So naturally, dystonia chronically they will be having, this constipation, no regular bowel, and their food habits generally will be irregular. And whenever they indulge in all these things, their issues go up. Sleep reduced, these things will go up. So we could see a direct connection between apana vayu and prana vayu in dystonia in the presence of Vyana. So apana, Vyana, prana is more effective. Basically, I'm happy that we have a venue wherein we can discuss seriously about the neurological manifestations. And I think the greatest role of Ayurveda in neurological manifestation is actually preventive aspect. Many a times when patients come to us at 50s and 60s, elderly ones, and they are already with Alzheimer's or already with stage 2 or 3 of Parkinson's or any other neurological problem, Seizure spectrum, the pathology might have started at the age of 40s, which seldom is recognized. And I feel very bad when we see such cases and we have limited options to give them a better life. People work a very hard throughout the life to have a comfortable retirement life, but unfortunately, in that period, these issues come up. So I think, individuals must be aware in their middle age, because when we are young, we have enough energy. So our body compacts with it. But when we are crossing 35, 40, during that time, we are more with our parental responsibilities, family responsibilities, XYZ. That is the period, which takes maximum energy from us. So during that period, if we are aware, many things can be prevented. So in that aspect, Ayurveda, role of Panchakarma, preventive things has got a great role. So when we are planning to discuss neurological manifestations in Ayurvedic perspective, my whole and soul vision behind the whole thing is so that at least if we can prevent these issues in at least a few in their old age, or when they grow, they may move on in their life, that will be a great thing that we can do. So when this course was discussed with me from the Veda education, my whole intention was basically, if through this knowledge sharing, if we can provide a quality of good life to people who are really suffering, or if we are successful in preventing these issues, that will be the greatest thing that we can do. So my intention in being this process is definitely this, and I'm sure we'll be able to do that. So that would make me happy as a person, as an Ayurveda physician. That's it. Yeah.
Okay, thank you very much.
So namaste, thank you. Happy to be with you all. Wishing you all a very good day. Okay.